Hi. Yes, Hannah, AI. That's what I'm talking about tonight. Hi, Belle. Hi, Merlene. Is that how you say your name? I hope I said your name right. And hi, Hannah. Alrighty. Okay. Good. I like your name. That's very pretty. Hello. Oh. All right. Thank you all for joining me, especially because I didn't announce what tonight's topic was going to be. But it is going to be about artificial intelligence and a free chat. So if you guys have any questions or if there's something on your mind you want to ask about, let me know and we will talk about it, sort of as a makeup for not doing a Q&A Tuesday. All right. Oh, and I love the blue heart. Hi, Maria. Well, I hope you all had a great day. I had a fantastic day. Aside from my leg hurting, because I still, I have I pulled a muscle the other day and I am still feeling pain from it. Not excited about that, but I was hobbling around at work and I did my presentation for the local AAPC area chapter, so I was very happy about that. I have been so excited about it for months and I finally did it, and I think I did pretty good, except for a little hang up with the technical thing. I'm just not good with tech stuff, guys. I don't know, like all these different meeting apps and just trying to get it to go on right. It's like, can we work right, please? Um, so yes, so that was my day today, but it was on a high note, so that's good. Being that I did that, speaking, it was nice to do that, and I was talking about injuries, which is of course my favorite thing to do. So, but anyway, yeah. So today we're just going to be having sort of a free chat, and I'm going to be addressing artificial intelligence questions because I've been getting that question on email quite a bit. People are concerned, hey, Blue, is medical coding really going away? Are we going to be replaced by artificial intelligence? Can you talk about that? So I submit to the will of the people. I will talk about that today. So, but yes, if you have any questions, let me know. And we will talk about it tonight. All right. So it is now 7:30. I will go ahead and start. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. And today we are talking about artificial intelligence. Is it taking over medical coding? So let us begin. All right. First of all, I will say this. They have been saying artificial intelligence is going to be taking over since before I started, which was in 2008 is when I got my certification and I started working. I was in school for medical coding in 2007, and they were already saying it since then, and they've been saying it probably since the 80s, because that's just when medical coding was really up and running, and they said, oh yeah, you're going to be replaced by the year 2000. Well, 2000 came and went. And they're still saying it, and you still have some people out there that are saying it. You'll have some veteran coders that are saying it. Me speaking as a veteran coder, I'm telling you that the technology to do something that detailed and that specific is going to be still far away, because of the simple fact that you have to literally design a program that can literally read the provider's mind and literally read the patient's mind and be able to put it all into a document that makes sense. It's not going to happen, guys. I mean, is there going to be technology that's going to make things a lot faster? Of course, because that's the invention of the encoder. Obviously, proved that, but the encoder is still flawed, right? You still can potentially get to the wrong code if you use the encoder improperly. Okay, so as far as like these electronic medical records and how they come up with the computer assisted coding, right? The CAC, if you've heard of that. it is just about how these programs are designed, and they're designed by, of course, human beings. The programs are only as smart as you're making them to be. So, with that in mind, this is not something, medical records and medical documentation is not something that you can just put into a computer and let it go. It still has to be reviewed by a human viewer who can think and reason, right? Because the computers and the software programs are only going to go by what is programmed into this. So at the end of the day, it still is on the coder to be able to look at this documentation and be able to interpret it. So if you're hearing that artificial intelligence, oh yeah, it's going to be taking over, they've been saying that for eons, guys. And again, it's going to take a very sophisticated program, a program that is obviously very expensive to come up with. Then you have to think of all these things. It's got to come up with all of these different ideas and parameters for everything to be able to meet. So yeah, no. So if you're hearing that again, you're going to hear some people say things, and they're going to say things based on the things that they know or the things that they think. So at the same time, it's just like, really, no. There's so much of that chatter out there. The idea is, don't focus on that chatter. Focus on your goals and your reason for getting into medical coding, because it's still a very vast field. It is still something that, us coders, we learn all the time. And it is a constant learning process when you become a medical coder. And even when you are a medical coder, it's still an active process where you're still trying to learn. I say this all the time. We have to know what doctors know while never having gone to medical school. And with that, think about these doctors. They have to continue to learn as well. I see all the time my surgeons, I see them with a book studying. And if you've tuned into one of my other favorite YouTube shows, it's by Dr. Antonio Webb, and he continues to study as well. So, and he's been, he was in school for 14 years, and he's an ortho spine surgeon. So that tells you something right there, Guy says, I had a brain transplant a couple of years ago. Okay. Hi, Ashley. Hi, Guy. Thank you for the positive info. You're welcome, Maria. Hi, Christina. So yes, again, don't listen to the naysayers, and don't listen to the sky is falling type people that put that information out there. They're not the last authority to be saying things. Okay, just think about that, and think about who you're listening to. This is why I say you have to be very careful about who you listen to and who you are taking advice from, right? I'm going to be realistic with you guys. Yes, there are things that change and update in the future and things like that, of course, but do we know what's going to happen in the future? No, is it more important to be aware of what's in the here and now? Yes. Is it more important to make yourself a high caliber coder? Yes, it is. Because the more you study and the more that you read over the guidelines and the more that you get into the disease process of whatever clinic or specialty you're in, the better off you are. Okay, so there's a lot of things that you can still do with this knowledge anyway in the information and in the setting of health information. So think about that, and there's always been those ideas of, oh yeah, well, it's all going to go overseas. Well, guess what happened? It came right back. So again, there's a lot of people that do that, and they have different reasons. People have different motivations for saying those things and putting those things out there. But again, you have to really kind of focus your attention away from those naysayers. Hannah, like that biller that tried telling me to do billing because coding wasn't going to be here for long. Exactly. And that's somebody that, hi Katoya, that's somebody, when they say things like that, that's somebody that's what they do. They're billing. They've never done coding, probably. And I don't know that person's, background, but if they've only done that, really, coding's been around for a long time. The one I would be concerned with, of course, is billing, because billing has a set way of doing things. So that the process to be a biller is a little bit more automated, whereas we are not. We can't. We still have to be able to reason and rationale what we're looking at. Whereas with the billing side, you're submitting information, you're negotiating with the insurance companies, but that can also be done, other ways, more just streamlined, informed ways. So again, that to that lady, I would have said, well, I wouldn't I wouldn't really put the finger too much at the coders. You need to really kind of look at yourself, because anybody that's going to discourage somebody like that, come on, man. There's no need for that. At least I think so. But yes, yeah, that artificial intelligence. A lot of people get. I get letters all the time. People asking me that question. Is it going to take over? No. And they were telling me that when I was in school. Again, I was in school in 2007. They go, oh yeah, if I had listened to that, of course, I probably wouldn't even be here. You wouldn't even know me. So, I mean, that's something to think about. I tend to not think of all these other things that are going on, these external things, when I'm focused on doing something. And I try to share that with people, because sometimes people just don't know where to start, or when they're doing this, who to listen to. That's why I always tell people to stop. If you don't know who to listen to, stop and start going to more reputable sites and more reputable resources. I was doing the presentation, right, for AAPC local chapter, which I was very excited about doing. And in my research for the presentation, I was looking at a particular scenario, and of course I was looking it up on the internet and see what I could find that could support what I was saying. Well, a lot of the things that I was seeing pop up were incorrect, and I knew they were incorrect because I had recalled, and I couldn't remember at that moment where I had seen it until I looked in the coding clinic. Now, the coding clinic is one of the authoritative voices when it comes to medical coding. So, of course, it's right there. And I was like, okay, I'm going to believe the coding clinic before I believe all this other stuff. And these other people were like speaking very authoritative, and oh, yeah, it's this, and oh, yeah, it's that. But they couldn't give a resource to how they came up with their argument. So, again, going to the source itself is the best way to go. And when people are trying to either scare you out of doing this, or make you second guess yourself or think again, because oh yeah, it's gonna artificial intelligence is gonna take over, you're never gonna be able to get a job and that kind of thing. You can get a job, folks. For all those people out there that are struggling to find their first job as brand new medical coders, you can find a job. You just have to keep going. I've seen so many people say, well, Blue, I'm getting so tired. I'm so frustrated with having to look for a job. I went through that too, guys. I went through that. I had all those, things up in the air, and all this stuff that I had to go through on my own, right? But going to the temp agency, that was what got the ball rolling. And I was able to get my first job that way. My first and second job that way, by going through the temp agency. So everybody has their own process of doing things and being in medical coding, and what are they going to do, and how did they start. It's all about thinking about your why and what your path is, and again, not being diverted by just because somebody said, oh yeah, artificial intelligence, or yeah, overseas coders. No, just move that aside and just keep going. That's all you can do. And the more you keep going, the stronger you're going to get, because you're going to have those negative people that will try to stop you from doing what you want to do. And they have their reasons. Some people feel like, oh, well, you're going to do better than me, so I'm going to try to discourage this person. So that's what they do. And not everybody who smiles to your face is actually supporting you. You need to think about that as well. So get that stronger, steely self going, so that way you don't have to get knocked down by these arguments like artificial intelligence, or any of these other crazy things that people try to say. So hi Simone. But yes, when it comes to medical coding and this industry, it's still vast and it's still big, and we're all still learning. Whenever I go to conference, I look at all the things that I learned there too. And there are some things that when I hear the people talking, right, as you go from class to class, they're like, oh, I didn't know that, or oh, I didn't know that. Conference is a great way of sharing ideas. I'm disappointed that, of course, AHIMA is not having theirs in person this year, but hopefully next year things will get better with this pandemic, and we'll go back to having in-person conferences, you know. Hi, Aurora. But yes, so, you know, those just some of those things that I wanted to address today because, again, you see those negative things out there, and guys, don't listen to that. You know, don't listen to those negative naysayers. And oh yeah, don't think about something that is so far in advance, right? Because again, they'd have to literally invent a program that can read the provider's mind, because, you know, providers will document beautifully one day, and then the next day somebody, you know, gave them the wrong kind of coffee and it completely throws their day off, and I'm not going to do my beautiful documentation today. I'm going to give you the bare minimum. And they change their attitudes all the time. So think about that. You know, how could that translate into a program, right? How could that change and eliminate us as coders? You know, so that's something that you want to keep in mind. Again, you'd have to think. And again, each individual person is unique. So you may have one patient with tons of comorbidities, and you have another patient who's healthy, you know, but with just a single problem. So something to think about. But yes, make yourselves useful and still continue to study. Do all the things that you know you're supposed to be doing. If you know you're supposed to be studying because you have your certification exam coming up, you need to get on it. Nobody's going to sit there and pass that exam but you. If you know you need to be out there looking for a job, nobody's going to be able to apply for those jobs but you. So that's why I say keep getting out there. If you're a medical coder now and you are struggling to understand your clinic and none of your coworkers want to help you, get the book. Start reading the book again. Get familiar with it. Start reading. Start looking at the different YouTube channels that I've been mentioning. There's one for AZ Anatomy is the name of it. So, see, I don't know who that is. So, do I answer the door? Heck no. I'm going to keep on doing my live show. So, no, I don't answer the door if somebody knocks on it. But anyway, so that being said, you want to make sure that you are doing like you're supposed to and getting in there and digging in like you should. Okay, because in those times when it's going to get tough, the only one that's going to be there to get through that time is going to be you. And it's going to make you grow. And yeah, it's going to make you want to scream and run from it. But if you stick with it, it will reward you. Okay. Merlene says, any advice I'm thinking thinking. Are you thinking about taking your CPC in September, or are you going to take your CPC in September? So if you are going to take your CPC in September, okay, so you're taking it in September. If you are taking it in September, it's okay. I just want to make sure I know which advice I'm supposed to give you. If you are taking your CPC in September, trust yourself, okay? Don't second guess yourself. Go with your first instinct on your answer. Don't overthink. And please, whatever you do, do not cram at the last minute, because that's the last thing that you want to do is cram for a test. The only thing that does is mess with your head. Okay? You want to make sure that you're not going to learn anything new, right? The couple days before or the day before your exam. So stop studying a couple of days before your exam at least. Give yourself time to relax. And then when you go in there, just do the best you can. That's all you can do. Because at the end of the day, if anything happens, just take it again. You know, make sure that you're looking at the question and you're paying attention to the answers. Okay, look at the answers that they're providing for you, because the CPC is a multiple choice test. And look at it. Make sure that you are paying attention to those details. The details do matter. Okay. So again, don't get hung up on all that stuff. If you absolutely don't understand a particular procedure, that's okay. Just select whatever you think is best and move on. Don't get hung up on something that you don't understand. Okay? So, you know, you take water. How long have you been studying, Merlene? You're welcome. I want to be a medical biller. What does it say? And you're welcome, Merlene. Micah says, I want to be a medical biller. Is a 6-week program or course enough? You can actually, Michael, you don't even need to be trained to be a medical biller. You can actually just apply. Because if you're looking at these job listings for medical billers, they're not asking you to have a certification or even be trained for that matter. A lot of them are saying that they want you to have experience. But even if you don't have experience, that's okay. Do you have something that's transferable, right? Do you have a transferable skill? Maybe you worked in a warehouse or something, or did like the shipping and the ordering and that kind of thing. If that's the case, then, you know, put that on your resume as a transferable skill. Did you do any of the billing for that? You know, that is something that you can put on there, and that will help highlight some of the things that you can do. Can you use Excel? Can you use Word? And those are things that it's important for billers to be able to know how to do. Do you have negotiation skills? That's another important skill for medical billers to have, because you're working with the insurance company and you're working with the patients. So that is something that you need to think about. When it comes to being trained for medical billers or getting certification for medical billers, I never recommend that. I recommend just going and applying, because again, why put out money when you don't need to? Okay, because every place that does billing is going to be different because of the different insurances that they use. And if you want to get a jump on perhaps, you know, how do you bill for this one or how do you bill for that one, go to cms.gov, and that's going to be your source. Because the Centers for Medicare and Medicaid Services, they are the leader in how all these other insurances model themselves. So a lot of what they have on their website is what a lot of these insurances, they're like, oh yeah, well, we agree with that. Because they're going to be very conservative in how they're paying out this money, right? So if you want to get any kind of jump on education, that's the place to go, okay? Merlene, you've had plenty of time. If you've been studying since last year, then you were in a pretty good sized program. I get nervous when people tell me that they had gone into like 6-month programs, 4 to 6 month programs, and they want to get out and take their test to be a medical coder. That scares me, because I feel like if you are going to learn this, you need at least 9 months, 12 months, or 18 months. So from what you've said, you know, you've had plenty of time. So again, don't cram, you know, just relax. And this is just that time to shine, and that the culmination of all the things that you've learned is going to be on this test. Okay. Justin, I thought medical billers just submit what a coder does to the insurance and take payments, or am I wrong? Justin, they do, but they do a lot of other things as well. They also take the money from the patients, you know, they collect the money, and they do a lot of other things. It's not just taking from what the coders give them. Sometimes the biller is the biller and the coder, and it just depends on the size of the facility or the doctor's office. And the biller will be the one to basically take what the doctor has selected, because not all places have medical coders. And so the biller will just take whatever the doctor selected and then submit that to the insurance company. So then it kind of falls on the biller to be kind of good with coding and the billing, so that way that they can continue to get paid, because the provider is probably not going to select the correct code every single time. And if the biller doesn't understand that and then they just send it, you know, that is where a lot of that money can get lost. So that's why having a certification in medical coding really helps when you're doing billing, you know. And then Christina responded to you, Yolanda, billers and coders will be around for a long time. Artificial intelligence and computers can be hacked. That's correct. And Merlene says, okay, thank you. You're welcome. But yes, that's the thing, the ins and outs of, you know, studying for your exam. When it comes to that CPC, I've never taken the CPC, so disclosure on that. But I have trained and helped many people with tutoring, you know, through tutoring when they're getting ready to sit for their exam. So, I mean, that is something that I've gone over the books with them, and I've gone over like the strategies of like, okay, you got to trust your first instinct. You got to make sure that you understand what these modifiers are. Look through the book itself. Get yourself familiar with the book. It's not just about, oh, well, my book is tabbed. You know, when I went to go take my certification exam, the very first time in 2008, I did not have tabs on my diagnosis book, and I did not have tabs on my CPT manual because AHIMA was very strict at the time. I took my CCA. So I didn't have any of those tabs, and the tabs I still do not like. They get in my way. I do have my CPT book tabbed right now because I had demonstrated it for you guys, and I just haven't taken the tabs off. But because I could not rely on tabs, that forced me to have to get familiar with the book. So literally opening up the book and looking inside, and you may see modifiers. Well, on the inside cover of the CPT Professional Edition by the AMA, the CPT manual you're supposed to have when you take your certification exam, the inside cover has all your modifiers. It tells you what the modifiers are. So you're not having to flip through the book and look through those appendixes. The appendixes also have a lot of really good information, and people bypass those appendixes all the time. But they do have the anatomy plates in them. So, it really all depends on what books you have that you're using. But of course, everybody has to use the AMA edition of the CPT manual. So get familiar with your book so that way you can be comfortable with it. It's not going to be so scary for you when you go and you're trying to look up these codes. You're going to know exactly where to go because you're going to be so familiar with the book. And so that's my advice for anybody that's going to be taking their certification exam soon. Okay, I see another comment coming in. There's a little delay. Tina says, I am taking my online course and learning both outpatient and inpatient. What exam do I take that reflects that? Are you confident? It's up to you, but are you confident in your skills for both inpatient and outpatient? If you are looking to get certified through AHIMA, then you have the choice between the CCA or the CCS. The CCS is the gold standard of medical coding credentials, but that is a very advanced exam. The CCA is the same way, but it is the beginner or entry level is considered, that exam is. And so it tests you on both inpatient and outpatient, but it is a shorter exam. It's 2 hours, but don't let its size fool you. Okay, I had that. And there were 34 people in my class. I was the only one to pass that test the first time. So these tests are very tough. AHIMA has some of the toughest exams in the industry. So that is something to think about. If you are wanting to, get tested on both inpatient and outpatient, the CCA or the CCS is the way to go. Okay, but again, CCS is going to be a lot more advanced. It is going to be harder, and it is a longer test. It is a 4-hour exam. Okay, but if you only want to do only the outpatient, maybe you are just confident with your CPT coding, the outpatient side of the house, right? Then you have a choice between the CCSP or the Certified Coding Specialist Physician Based. That is a mastery of the outpatient setting. Again, that is a 4-hour exam, and I believe it's 4 hours. Let me look. I don't want to think, because I think it was 4 hours. I just took that exam. You think I would have remembered it? Let's see. So the CCSP certification. CCSP. 4 hours. Yep, it's a 4-hour exam. And the total number of questions on this exam range from 97 questions to 121 total items. The exam consists of 2 sections, a multiple choice section and a medical scenario section. Evaluation and management, surgery, and medicine are asked on that one. And the exam is computer-based format, okay? So if you are wanting to just test on the outpatient side, the CCSP with AHIMA is the way to go. If you are looking to be certified with AAPC, then you're looking at the CPC. But keep in mind, if you take the CPC, you will have a -A for apprentice for the first 2 years. Or if you get a job and you pay for their AAPC educational product called PractiCode. PractiCode is a batch of records that they give you to be able to code. These are real life scenarios, and you code these, and then when you get done coding all of these, then they will take 1 year of the 2-year commitment you're supposed to have that A on. They will remove 1 year. So if you're working and you do PractiCode and you're working concurrently with this, you can have your A removed in as little as a year. So if you're wanting to do that. But as I have said to the people that have been in my audience and have said that they've gotten jobs with a CPCA, if you have a job, why do you need to get the A removed faster? You already have a job. In 2 years, it'll be removed, you know? So, I mean, what's the rush at that point? But that is just what I'm saying on that one. But yes, so you have your choice between the two. There is no A when it comes to the CCSP. CCSP is literally like, you know, right out of the gate, there you go. You know, there's no apprentice status. Apprentice is only with AAPC credentials. So AHIMA does not have that. And with AAPC, they require you to be a member before you can pay to take one of their certification exams. You do also have to pay for the membership every year. If you don't pay for your membership every year, they will revoke your certification. AHIMA does not do that. They have prices for members and non-members. So, you know, that's just something to keep in mind. All right. Yep, and the CPC exam is 5 hours and 40 minutes. It is a paper-based exam, okay? So you can go back if you need to review any of the questions again. You can do that. With AHIMA's exams, they do not allow for flagging on those anymore. So basically, when they present you with a question, you have to be able to answer it and move on because they don't allow for flagging. CCA it is then. Thank you. Okay, Tina. Justin, goodness, over 5 hours, a major exam, not even ACT or SAT is as long as the CCS exam, or as long as the CCS exam, or even GRE. Hi, Isabel. Yeah, I mean, and it's just, I mean, people have gotten through it in less time, you know, so it really all depends on the individual. So they timed it out to like a little over 2 minutes per question or something like that, because it's 150 questions on their exam. So, you know, and you have to get, I may as well bring up the AAPC website in case anybody, I know, Tina, you said that you decided which one you wanted, but in case anybody else is thinking about the certification for AAPC, the CPC. So it is 150 questions, and you 150 multiple choice questions, 17 areas of knowledge. So basically it is testing you on every single chapter in the CPT manual, and you also have 10 questions about diagnosis coding, and you have to get 70% of those questions correct. It is a passing score, 70%. Okay. Tina says, my course has practicum that is considered a year of experience. Does that really apply to workplace regarding hiring? No, it does not. There's a lot of people who will say that, oh yeah, just put it down as a year of experience. In order for experience to count, right, you need to be under production standards and accuracy standards. Those are the two, because they're going to ask you, what was your production standard and what was your accuracy rate, right? So if you can't answer that, then you've already lied to your potential employer. Not a good thing to start off with, right? Some employers will take education in lieu of experience. Now, if they say that, then of course, yes, you can put that down that you've had Practicode because that's an educational product. That is not work experience. So no matter what they say, oh yeah, you can use it as work experience. No, you can't. Okay? And they know that stuff. Hannah, I'm still so hung up on anatomy. I've watched the videos, done the coloring books, read the vocabulary, and nothing sticks. Oh, Hannah. Rain? Is that rain? I think it's rain. Rain. I like that. Rain, moonflower. Very hippie-like. I like it. I take my CRC on the 28th. So, I mean, that is something that, you know, you need to think about when you're taking these certification exams. Look at the associations themselves. I've always recommended that you guys check out the associations, you know. because each one of them has their pluses and their minuses. AAPC is very grassroots, and so there's a lot of people with them. And even when you go to the website, it's like all in your face. And so with AHIMA, you know, it's a hit and miss. I've heard people complain about the AHIMA customer service. I've heard that complaint several times, and I just had a message come in. That's all. I've had many complaints about them, but then when I've called, I mean, they've always been very, you know, right on the money. So, you know, I don't know. Thanks. Opinion: does having a bachelor's of science in business have 12 years experience in stuff? Is it going to help you? Is that what you're trying to ask, Tina? And while Tina is answering the question, Hannah, you're probably being too hard on yourself, honey. Just take a step back. Don't worry about it. It's probably sticking. It's just you're just probably just concentrating on it so hard that you want to make sure that you want to get it all. And I get that, but just relax. It's probably sticking and you're not even realizing it. You know, it's just a matter of taking a step back. Yeah, you could try Quizlet. They have some pretty good little things on their Quizlet too. Yes, I am nodding my head. Can't you see me? Okay. It depends on how you market that 12 years of experience and your bachelor's of science in business. Okay. If you are applying for a doctor's office, let's go there. If you're applying for a doctor's office and perhaps this doctor's office doesn't have a coder on staff, maybe it's the spouse, which it always is, like 10 times out of 10. If the doctor has a spouse and they're having their own little practice, it's always the spouse who's doing the coding part. If you apply and you say, look, I got a bachelor's of science in business. I got my certification. I understand this stuff. You know, you're more appealing because number one, you have the technical training. Number two, you've got that bachelor's of science in business. I mean, not only that, you can market, you can, negotiate, you can do a lot of things. So you've got a lot of skills there that you're sitting on, just having that bachelor's of science in business. You know, there's a lot of things you can do. Marry up those skills and think about the things that you can do with that, because again, you can do marketing, you can do negotiations, think of all the times that you've been in school and how you had to show your negotiation skills. It's the same thing. How do you talk to people in the boardroom? It's the same way that you got to market yourself when you're out there looking for a job. Okay. Quizlet is my next step. Good. Tina says, I've worked in planning, training, and sales. There you go, girlfriend. There you go. So it should not be hard for you because you got to get back into that mindset. Okay, you've got this good product, which is yourself, and you have your certification. Well, when you get it, right? Yeah. So then you're going to be able to say, look, I got all this training. I've got all this knowledge. Let's come on. Let's go. Any employer would be lucky to have you, but you got to be able to market yourself. Just like you would market a good product, you got to be able to market yourself. Okay. It's just turning it around. You're the product. How can you sell yourself? How would you want to what would make you as the employer want to have you as a employee? Think about that. Justin says, Hannah, I found Brainscape easier to use than Quizlet for some reason, but only for text-only flashcards, which is what I use. Not as good for images. No. But yes, thank you. Tina says, thank you. I've been a stay-at-home mom. Confidence is not high. But you know what? You've got that education. You've got to use that. You really have to use it. And if you've been a stay-at-home mom, I got something else to tell you. And of course, I want you to take this the right way, of course. Your children, whether they're little or not, they're always going to remember this time. This is how mom handled adversity. She had been staying at home with me. She'd been raising me and my brothers and sisters, if there's more than one. And, you know, she did this wonderful, amazing job. And if they're big enough to see what you're doing, they may not be able to understand it, but if they're big enough to see what you're doing, that's what they're going to learn. And that's what they're going to do in their life. So if they see you not being so sure of yourself, and even if they are little, maybe they're babies, you know, but they're going to look back at that time. That time is going to be told to them somehow, some way. That story is going to be shared with them. And they were like, wow, you know, my mom really did that. Yeah. So think about it. The second that you think, oh gosh, you know, my confidence is not really good, you can do it. If you can get a bachelor's of science in business, you can do this. You absolutely can do this. You just haven't been out in the work field, you know, to be able to start. But don't discount yourself before you even get out there, because that's the worst thing that you can do. No one is going to have your back on this one. You literally have to have your own back on this one. Because when it comes to how can you stay motivated, you know, somebody could be motivating you one day and then the next day be like, okay, you know, but you really have to be your own personal cheerleader and be like, yeah, I can do this. You know, I'm not going to let anybody stop me. My kids are watching me. Your kids are going to watch everything you do and how you handle that stress and how you handle getting out there. And even if you feel like, I don't feel confident, you need to show I'm confident, because all those, it's like a duck on water, right? Those little feet, they're going crazy at the bottom, but then you see the duck on the surface of the water just sailing along. You need to be the same way. At least this is my advice. Even with that gap, it doesn't matter. The gap doesn't matter. I never understood the gap. I never understood why employers would give somebody a hard time for a gap. You're raising children. I mean, come on. You know, I never understood that. It doesn't make you a bad employee. It doesn't make you a bad future employee either. Just because you have a gap, you're ready and you've been training along the way, you know. So at least that's just what I think, you know. Tina says, mine has graduated high school and I've stayed at home, really blessed her whole life. Yeah, well, see, there you go. See, and now that she's graduated high school, so then she's big enough to understand. Trust me, she's going to be watching you and be like, okay. And so when she sees you go out there, that's going to give her that confidence that, well, my mom did it and she took a break all this time, so I can do it. Hannah, be that duck. Yes. I interview like a boss. I used to. Old habits return. Yeah. Carol says, somehow I believe finishing a practicum, removing the A for my CPC is what I need before I get out there. I have transferable skills. Well, okay, here's the thing. Let me go back. Practicode. I'm not saying that Practicode is bad, right? Practicode is, it's a practice, right? So it's good. It's a good practice. It is a very good educational product. Do you need it? No. Is it going to give you experience to put on your resume? No. But if you want it, if you feel like it's going to make you a stronger, more confident coder, then by all means go for it. It is good practice, like I said. But you know, marry up all your skills that you have, get it on your resume, and then get out there. So don't take steps back. You'll be okay. Just keep going forward. Jill says, even Elon Musk warns that they should slow down with AI because it's a threat. There you go. And Tina says, thank you. Preach. I can tell you, Tina and Hannah, you both can do this. Stay focused. I worked a full-time job and still got my CPC and CCS. Took my time and got it done. There you go. You know, and I love that. I love seeing my audience encourage each other. I like that. I really do like that, because there's a lot of negativity in the world, and when I see positivity, it warms my heart. She is just sitting beside me. So she's big enough to understand. There you go. So what are you going to do now, Mom? You know, you got to get out there. You can do this. You know, don't think down on yourself. You've got it. It's like riding a bike. You know, you get right back into it, you know. And see, Carol's even giving you a thumbs up. And Maria, great advice. See, there you go. So, but yes, ladies, it's really, it's on us too, you know, and gentlemen, if you're watching this too, and you're going to be a medical coder, everybody is seeing how you're going to handle things. And when you handle things, you never know who is looking up to you. Because believe it or not, even if you feel like, oh no, nobody's looking up to me, trust and believe there's somebody out there that is admiring you. There's somebody out there that's admiring you and saying, gosh, they are so strong. I wish I could be like them. I wish that I had their strength, or they overcame this and I really wish I could be that same way. So you never know who's doing that for you, right? You just need to live your life and do things that you need to do in this life. We only get one rodeo in life. That's it. And then when you're done, you're done. But do you want to look back on your life thinking, God, I really should have, I wish I was more assertive. I wish I had spent more time doing the things that I knew were going to make me happy, or just learning something, or changing my life somehow, some way. You're not going to learn anything on the sidelines. You're going to learn it by getting in there and getting muddy and getting through that wall and, going forward. That's where your power in life goes, right? Because what you experience in this field, oh, trust me, there's things that I've experienced that I would have never have thought that I would have experienced, but I have, and I've worked with some extremely intelligent people, some of the most smartest people I will ever meet in my whole life. I have gone from being a very shy person, because I believe it or not, I am very shy. But I have gone from being very shy to being very confident when I speak about medical coding. And then when I'm in there and I'm speaking to these doctors who've been through years of medical school, and I'm able to crack through that exterior, that's what makes me so excited to go to work every day. And I don't feel like I'm working. So for me, that I get that, and I've been like this for almost 7 years now, it's like, who else can say that besides people who have tons of money and can do whatever they want? I don't feel like I'm going to work. I don't feel like when I get up in the morning and go to work, that's not work to me. Just when I go to those crazy coder meetings. But other than that, I don't feel like I'm going to work. I feel like I am at a place that I love to be at, and I get to read all day, which I love to do. I get to learn, which I love even more. And then I get to come here and share it with you guys. So that's not bad. It's not bad, at least I don't think so. But, you get to experience some exciting things. You just have to let yourself. You have to let yourself be able to experience those things. If I had said, oh, I don't know, and I'm going to stay shy and I'm not going to speak up and I'm just going to sit here and be a wallflower, I would have never experienced all the things that I have. And there's so much more that I know I'm going to experience because of this, and it's there. It's getting there, Yep, that's passion. Yep. And that's right. You have to have that, because for me, I don't think, like I said, I don't think of it as work. There's people that go to work and think of it, oh, it's a job. And, one day when I win the lottery, I'll get to do whatever I want to. But, that's sort of an empty feeling, because if you don't have something that you're passionate about, that you have that drive for, then what do you have in this life? And your children are going to grow up and they're going to leave. They're going to have their own lives, because that's what they're supposed to do. But what are you going to have? What are you going to look forward to? The grandkids, when they come there later on. But what are you going to have for yourself? It's okay to have things for yourself, because again, your kids are going to be watching you. I'm just saying. So, well, see, there you go. And I've been down that road before too, Tina. I was divorced. When I was going to school, oh yeah, I was going through divorce then. And it wasn't fun. It wasn't nice. And I had an ex-husband who told me, oh, you can't do this. Yeah. Oh, really? Watch me. And I did it, So, I mean, that's that was my driver. I mean, I wouldn't change. Unfortunately, divorce is sad. It's always going to be sad. But if I had gone a different route, I don't think that I would be here. I wouldn't be, being a medical coder. I would have done something else. My life would have went a completely different direction. So your life is what you make of it, and there are some sad times, and then there's the times that you're going to remember that you're going to enjoy. You're going to enjoy those memories. But it's okay. Once you get past those things, don't let those sad moments be a barrier or be the thing that you keep reverting back to, because at the end of the day, everybody's life and the way that they're shaped is who they are, and when you're comfortable in your skin and you're doing something for yourself, I mean, clearly you are doing something for yourself now, and I'm sure then too, everything makes you who you are. You're able to, deal with conflict. You were trained in it, and that's a good thing. But getting there and moving forward, that's your whole thing now. And having that power and that strength in yourself, that's really going to show when you get out there, You just got to do it. There you go. Hannah, I want to be able to buy my kid everything he wants. That's my why. Well, see, there you go. And you have a very cute baby too. Are they related? Hannah, and just FYI, Blue, your question of what is your why is stuck with me. Good. And I think that's one of my biggest reminders of being motivated, especially when I'm in my slump and unmotivated. Yep. So that's good, because that's exactly what you're supposed to do. You're supposed to think of that why. Because when the times when you want to quit and you want to just throw in the towel, then you need that why comes back and you're like, okay, that's why. That's why I'm doing it. On the days, because, I still have hard days at work. There's some days when some of my providers, one in particular, when he just wants to be stubborn and I need him to do something that I need him to do, and he will not do it because he will dig his heels in. And he gets me so frustrated sometimes, because I'm just like, dude, can you just work with me? Because at the end of the day, he's going to complain, and I know he is. And then I look over at my sign that they all signed for me when it was my 10-year anniversary a couple of years ago. And I said, that's why. That's why I deal with this. And I go back to doing what I'm doing. And so that helps me. So whatever you got to do to remind yourself of that why, that's what you got to do. Okay. Tina, I've cried over that. I am so done. Good for you. Good for you. Justin, a person who has a strong enough why can deal with any how. There you go. I like that. I like that. I really like that. So. Tina, I agree with Hannah. I'm motivated to get this done. I am cracking the books open at 8 a.m. Good for you. And remember to take breaks. There is a study tip that I saw where the person does the 50-10. They call it 50-10. So they study for 50 minutes, then they give themselves a 10-minute break. Then they get back into it for 50 minutes, and they give themselves a 10-minute break. So to me, that's a really good way to do things. Try not to go for more than 2 hours at a time. Give yourself plenty of breaks. Make sure that you drink water. Make sure that you eat. Because the worst thing that you can do is get run down sitting there. Justin, after this, I will open the books too. I finished my medical terminology flashcards. Good. I'm so glad, Justin. Yes. Christina, I'm getting excited. I'm starting CPT next week. You're on a roll. You are on a roll. I have seen you. You have just been flying through. Good for you, Christina. That's really great. I'm very happy. I'm happy for you guys that you're studying again. That's good. Keep studying, because again, it is just the beginning. But you want to keep making sure that you're doing what you need to do, and just stay focused on it. And if you need to take a break from it, take a break, come right back to it, okay? Because it's still going to be there. So, but yes, anyway, So does anybody have any other questions? Or don't fear E&M. Very true. A lot of people fear E&M. I did the E&M study hall a few weeks ago where I talked about like the different levels and stuff. So be sure to check that out if you're thinking about that. But yes, don't be afraid of E&M. It's really not that bad once you understand the table of risk. Once you get that, then it's going to be a whole lot easier for you, you know. But there's plenty of resources out there. Check out, gosh, what was it? Why did I blank on the name? Novitas. There is was it Novitas or was it EM University? Maybe it was EM University. I think it was EM University. They have a university, really Blue. They have a table of risk. Medical decision making. I thought I had put it in. Did I? Maybe I need to do it this way. Hold on. EM calculator. Because I think, no. It was either, okay, no. So, medical decision making table. Yes. Yep, that's it. Was that it? No, but it looks like a really good article. And it's written by Pam Vanderbilt, CPC. Okay, well, I guess I can, yeah, I'll just put this in here for you guys. Y'all can check this one out. I'm gonna put this article in there in the chat box, and that way you guys can check it out. Monica, what are good websites besides Indeed and Direct Coder to look for coding jobs? There's the association websites have job links too. The 5010 sounded like Dr. Antonio. It actually wasn't him though. It was somebody else, but maybe if he does it, that doesn't surprise me because the guy, he studies. He's a monster. He's a beast when it comes to studying. Yeah, but it sounds like him. But he's awesome. So I'm glad to know somebody else is watching him too. He is a doctor from San Antonio, or he's part of the practice in San Antonio now. And he's awesome. He's an orthopedic spine surgeon. He reminds me a lot of my surgeons that I work with. So they're all very quirky. When you meet an orthopedic surgeon, they are very quirky. But again, Dr. Antonio Webb is very awesome. I'm such a fan. But yes, but anyway, so that was the E&M article that I was wanting to share with you guys. But there's EM University if you don't know. Hi, Jamie. EMUniversity.com. That's another resource. Jamie too. Hey, Blue, I still haven't sat for my CCS, and I finished my coding school in April of 2020. I studied every day, but started slacking this year. I just started watching you again for motivation. So thank you. Get on it. You're welcome, Monica. Yes, 2020. What are you waiting for? That's quite a ways. I always recommend that when you finish a program, take your exam no more than 90 days after you complete your program, okay? Because the simple fact that the longer you wait, the more you're going to forget stuff. And you want to be able to remember as much as you can. You want it to be as clear in your mind as you possibly can get it. You know, some people kind of get on that hamster wheel of, well, I'll study for 30 days and then I'll take it. Well, I'm going to give myself another 20 days. I mean, not 20 days, but 2 months and I'll take it. Yeah, no. You need to take it because you're going to be ready. You know, you may not feel ready, but you'll be ready. COVID, I have been sheltered in place. Oh my goodness. Oh, okay. Well, that makes sense. That makes sense. Yeah, because you have to go to Pearson VUE to take your exam. Oh my goodness. Are you going to be able to schedule yourself? Jamie? You're going to be able to get out there and do this? I hope so. Soon. As long as you've been practicing, you know, don't let that time go to waste. Okay, good. And you got the laughing faces. Okay, good. Yes, I will be glad when all of this is over. No more masks. No traveling. I haven't been on an airplane in, gosh, when was the last time I flew? Chicago, 2019. Yep, that was the last time I flew. Yeah. Chicago was the last time I flew because that was the last trip that I did for AHIMA. Oh, man. School keeps postponing the voucher for AHIMA. Well, that's good. At least they're postponing the voucher. That's good. But yes. So, guys, stay motivated. You all can do this. You'll get out there. Once you get your certifications passed, you'll get out there, find your job, and then you'll be able to settle in. And then you'll be right here along with me talking about these providers and you know, how they do things to make us all crazy. But, you know, I enjoy them. I have 4 new surgeons. I was talking about them earlier this week. 4 brand new surgeons. 3 are brand new out of residency, which is even better. Because what a great time to get a brand new provider. I'm their first coder, so 3 of them anyway. Hannah, I fly in a month. First time for my kid. Wish me luck. Ooh, good luck. Christina says, add Jamie, if you ever considered the CPC, AAPC offers it online, and you can do it from the comfort of your own home. So thank you for all the video and support, says Jamie. Oh, you're welcome. Well, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me, and I really appreciate all of the good comments and for you guys encouraging each other. That's wonderful. Maximus the Clone says, I was searching the ocular section today for a code for bleeding eyes from studying too long. A possible add-on code for each additional day, month. You silly. Jamie says, Christina, I really want the CCS for the inpatient coding. And I had a mentor through AHIMA who was giving me hospital charts to code. Good. You know, I like inpatient. That's good. Yes. So, but yes, I'm going to go ahead and wrap this one up. Thank you guys again for joining me. I really appreciate it. And I will see y'all again tomorrow. Have a good Thursday night. Bye.